Welcome, everyone, to this Connecticut CASA in-service training session. We're pleased today to welcome Dr. Carla Stover from the Yale Child Study Center as our presenter. She's a Harris Professor and Director of the Stress, Adversity, and Trauma Program at Yale University School of Medicine, and specifically the Child Study Center there. She's developed an intervention for fathers we're going to hear about today to reduce intimate partner violence, child maltreatment, and substance misuse, Fathers for Change. And she's also written an accompanying book that serves as the manual for that program. It's called Fathers and Violence, a program to change behavior, improve parenting, and heal relationships. She currently has 2 NIH grants and is conducting clinical trials of Fathers for Change. She's presented trainings internationally on topics of family conflict, healthy relationships, family violence, engaging and treating fathers, and interventions for childhood trauma. And we're especially pleased that Dr. Linda Mays, who's on our board and who directs the Child Study Center, connected us to Dr. Stover. So, Dr. Stover, Carla, please.
Thank you. Well, good afternoon, everybody. I'm really pleased to be here and joining you. The work you do is really important, and I'm excited to connect with you and hear the questions you have. So I am going to be focusing my talk today on Fathers for Change. So I'm going to share slides just because I think it's helpful to have something to look at in addition to our discussion. So let me just get those up here. So it looks a little bit weird. Hold on, let me try this again. Okay, everybody can see that okay?
Yes.
Yes.
Okay, well, thank you. Just gonna share some. Okay, well. All right. So Fathers for Change is an intervention that I developed. So I started out, actually I should just say a little bit about how I got started. So I started out when I first came to Yale, I had been working primarily with survivors of violence and their young children doing child-parent psychotherapy. I was working out in San Francisco with Alicia Lieberman and Patricia Van Horn in that intervention. And I came to the Child Study Center and I was working with Stephen Marins as part of the Child Development Community Policing Program. And I was doing a lot of outreach in the community after incidents of domestic violence, trying to connect with moms and children and connect them to services. And it became clear to me through that work that there really wasn't, of course, this was back in, I'm going to age myself, but the early 2000s, 2003, 2002. And there really were not interventions available for fathers who had used violence. The only available interventions were court-ordered batter intervention programs that we'll talk a little bit about in a minute. And so I saw a gap in the service array that was available, and I started to become more interested in that. And so I'll tell you a little bit more about that as we get going. But just to be clear that my work really started from the viewpoint of the surviving mothers and children who are experiencing domestic violence or intimate partner violence. So one of the things that I started to understand and that is clear in the literature is there's a really significant overlap between intimate partner violence, or I'll use the acronym IPV, substance misuse, and child maltreatment. If you interview offenders, people who are arrested for intimate partner violence, who are coming into batter intervention programs, those groups that people are mandated to, about half of them have substance use problems. If you interview men coming into substance misuse treatment, about half of them will endorse that there's IPV in their relationship. And then there's about a 50% overlap in those conditions with child maltreatment. So all three of these things together constitute a really significant problem for families. And when all three of these things are happening, the outcomes for children are even worse than if only one is happening. And when we think about, well, why do we want to focus on fatherhood for men who use IPV? Like, is that really where we should be focusing our attention? Fatherhood really is a motivator for some men to engage in services or engage in some kind of treatment. And many fathers, if you ask them directly, they are concerned about the harm that their children may be experiencing as a result of the violence in the home. And fathers report a wish to have a better relationship with their children, and they want to be good parents. That's something that seems to be universally true. People want to be good parents. Now, how they define that and how they go about it, we may disagree, but they want that. And there's also some evidence out there from some other work that I'm not going to talk about today that co-parenting interventions can actually reduce IPV behaviors, especially psychological and verbal abuse. So the treatment needs that were available and what options were there. So when I started out, and this is still largely true, although it's changing, that the treatment availability, if someone had a history of IPV use, the only thing that was really available were these group interventions called batter intervention programs. The first one was developed out of Duluth, Minnesota, and it is based on the power and control wheel that you see here on the slide. For a long time, it's been the unchallenged treatment of choice. So men are put into a group, they focus on learning about these power and control dynamics and the ways in which they're using them. And it's based in feminist theory that, IPV really comes from the idea that patriarchal views in society about how women should be treated. And that's the leading cause of violence. So they really focus on that. And then there's been some combination programs that have anger management skills or cognitive behavioral skills to try to reduce and control men's anger, and sometimes the groups kind of mash together both of those ideas. And they're out there all over the place, including here in Connecticut. They range from 9 weeks, which is our shortest program here in Connecticut, called the Family Violence Education Program, to 52 weeks, which is, a year-long program. The one in Connecticut, I think, is called Evolve. And they've been the unchallenged treatment of choice. They're typically mandated by the courts. And so in order to get into these groups, you have to have been arrested. That's how they work here in Connecticut. But the problem with these kinds of programs is the outcomes are really quite poor. So there have been a couple of meta-analyses. There's actually more than these, but I'll mention Julia Babcock. She's done a couple. She did one in 2004 that actually was the first paper I read that got me thinking about this. And then she just redid her meta-analysis in 2024. And the outcomes were the same, that when you compare men in batter intervention programs to those who really got nothing, the outcomes are really no better. And so that's in terms of recidivism for domestic violence. So I'm not suggesting the programs do nothing, but when you hurdle men into court that are arrested and you give them all the same thing, they all get the same program, the outcomes are poor. So I got to be thinking about that, in addition to some of the other things I was seeing, which was that there were the batter intervention programs that these men had access to did not address the overlap between intimate partner violence, substance use, and child maltreatment. So there really wasn't a discussion about that or thinking about what are the common causes of these three conditions and why would people be having issues with all three of these things? What's driving that? Certainly men's views about women and patriarchy isn't necessarily causing substance use, right? So how are we understanding that? There's a lack of focus on the impact of generational trauma or adverse childhood experiences on people's relational skills, their attachments, the way they think about the world, the way they regulate their emotions. So that wasn't really a part of those programs. There also wasn't an assessment of individual family needs. So what's happening in this particular family? Everybody, goes and gets the same program, right? Delivered in a group format. The programs couldn't focus on fathering very much. There is usually a session or two on fatherhood and parenting in these groups. But when you're putting together men who are, 22 and have no kids, or people who are 50 and have no kids, and then men who are actively parenting, you're not going to spend a lot of time on parenting when you've got people in the group that aren't parents. So you can't focus on that too much. And then the other thing that was really important to me was that it seemed like fathers were not being held accountable by child protection at that time. Basically, a man was arrested for IPV, Child Protective Services would be notified by the police, TCF would do an investigation of the IPV, but all of the burden was placed on mothers. So mothers had to keep their kids safe. Dad needed to move out of the house, the mom needed to protect the kids from dad, and she also had to engage in all these services for herself and her children, and dads didn't really have to do anything. So that didn't seem right, partially because they weren't being held accountable when they were the ones that were using the violence, but also we weren't providing dads with any kind of intervention opportunities that we often provide to mothers who cause harm. So mothers who are, have child maltreatment reports or who are using substances, there were all sorts of intervention programs available to them while still parenting their children, and we weren't thinking about that for dads. So that being said, I went ahead and I got a grant from the National Institute of Drug Abuse and also from the Annie E. Casey Foundation to start to pilot and develop this intervention that I've ultimately called Fathers for Change. And I started out working with dads with young kids under 6, and now we actually work with dads and kids of all ages, but it's primarily targeting children under 12. There has to be a history of physical or psychological violence of some kind in the relationship between the parents. Substance use can be a co-occurring concern. When I started, we were only working with dads who had co-occurring substance use and IPV. Now we've expanded it out. Sometimes we see dads that have substance use only. Sometimes we see dads that have IPV only. So both of those factors are considered in the treatment. And that the father has at least some contact with his child, or there is planned contact. Maybe he's not allowed to have contact now, but he's working toward having increased contact or visitation with his children. So the intervention includes 18 possible topics delivered over, about 6 months of time. It's 1 hour weekly individual, or some family sessions are possible, which I'll talk about. So it's not a group, it's an individual therapy, and it is a clinical intervention. It's not a psychoeducational program. It's delivered by master's level clinicians. So there are some 4 core topics as well as some optional topics that can be implemented based on the family's needs. And there is optional co-parent or survivor participation in the treatment if she would like to participate. And I can talk in the question and answer period more about what that participation looks like and how we ensure safety. And there's also some optional child participation also if it's considered safe and appropriate and both parents agree to it. So the intervention focuses on these reflective functioning and emotion regulation as our target mechanisms of change. So there's a lot of literature out there that fathers who use IPV and have problems with substance misuse or who maltreat their children have really significant problems with reflective functioning, which is understanding their thoughts and feelings. Right, being able to identify how they feel, how they're thinking in different situations, and that those thoughts and feelings might differ from someone else's, and that someone else might have a different experience, like particularly their child or their co-parent might have a different experience of a situation than they do. So people who use IPV tend to have really poor reflective skills, and then that is associated with having really poor emotion regulation. So being really either disrupted, dysregulated and aggressive, shutting down in situations, not being able to process feelings. And so the idea behind this intervention when I was developing it is that really targeting these 2 mechanisms and working hard to help people improve these 2 things will reduce their IPV, will improve their parenting and increase their symptoms overall. So I'm going to play now just a little video so you can hear some clinicians other than me who deliver Fathers for Change talk about it, as well as some fathers who actually received it. So it's the 3 minutes, it's short. Fathers for Change is an individual intervention for men who've had struggles in their co-parenting relationship because of significant conflict, aggression, violence, or substance misuse. Clinicians meet one-on-one with clients weekly. The intervention lasts 16 to 24 weeks. It addresses emotion regulation, communication, and relationship difficulties.
So connecting with my girlfriend at the time was both the problems, and DCF got involved. But in the end, she's taught us about anger issues and just controlling your emotions, active listening, really connecting with each other. Not just a relationship matter, but a parental sense.
Oh, sorry. Can people hear it okay? Fathers is an individual intervention. Sorry. Can you hear it okay?
Yes, I was able to hear just fine.
Okay, sorry. Sorry about that. Gotta not touch anything.
Both the problems, and DCF got involved. But in the end, she's taught us about anger issues and just controlling your emotions, active listening, really connecting with each other. Not just a relationship matter, but a parental sense.
Clinicians work to understand the unique needs of each father and help him develop skills to improve his relationships with his co-parent and his children.
The part where you listen to how everybody feel, that was most helpful. Because before coming here, I didn't like to listen to how everybody else feel. I only cared about how I felt in both situations and how to handle it. And I didn't want to listen to anyone.
A lot of other programs out there have labeled these fathers either as a perpetrator, a batterer, an abuser. And Fathers for Change is unique in that they identify them as a father.
They look at the role of the father, as a spouse, as a parent, as a co-parent.
The Fathers for Change model incorporates skill building in addition to helping parents reflect on how their past has influenced their present, and not just how they're thinking and feeling, but how other people are thinking and feeling in response to their pasts or their current interactions.
Fathers for Change begins with a comprehensive assessment to be able to tailor the intervention to the unique needs of the father and family. The intervention focuses on reflective functioning to increase fathers' understanding of their thoughts, feelings, and actions, and those of their partner and children. It also provides practical teaching and practicing of emotion regulation and communication skills. It allows for optional co-parent participation and assessment, weekly parallel sessions, and conjoint co-parenting focus sessions if she chooses to participate. Fathers have the opportunity to think about the perspective and experiences of their children and to make amends for past behaviors with clinician support.
My husband has done anger management. He's done psychoeducation classes around domestic violence. And he's done domestic violence groups. And nothing worked. If you asked me 6 months ago what you should do with my husband, I would tell you, throw him in jail. But this was the only program that worked for him. I've seen such a significant change in his behavior. It's a whole new person.
Quite a few fathers tell me that they have been very happy that they engaged in the program. Because it's just completely different.
I love this program. It's helpful. Yeah, I tell my friends, I tell everybody about it. Family, I tell everybody, anybody I need to, anybody important, I tell about this program.
If you want to be the best father you could be possible, I would go to a class just to prevent myself from ever being in a situation of being either terrible co-parenting or feeling like I don't want to be a father anymore or it's too much stress. Like, I never have had that thought after this program.
Fathers for Change. Healthy fathers means healthy families raising healthy children. So that just gives you some of the voices of other people doing the intervention. So this is just to give you a quick snapshot of what the intervention involves. So as I mentioned, it's an individual therapy. And as you heard in the video, there's phases of the intervention. So it lasts about 6 months, but it starts with an assessment and then it moves, if fathers are appropriate, then they move into this motivational engagement phase. And this is really to try to help them identify their goals for the program, use motivational interviewing to help them, start to become motivated, that they might have some behaviors they need to change, reflecting on their family of origin and what did they learn about emotion regulation and how to be in relationships with others and how does that impact the way they show up now in their own families with their partners and children. Once they move out of this phase, they go to the individual focus. And so here is where we really try to dig in and start developing their own emotion regulation and reflective skills. We focus on how does your nervous system work? What are the ways that you're triggered? What are your triggers? How does that feel in your body? How do you know you're triggered? And then what are the regulation skills that you can use to better develop your nervous system? Because we all have nervous systems and we all have things that trigger and make us reactive. So it's not so much that those things happen to you, but what do you do when that happens and how do you better manage your behaviors? If a father, is engaged in this, moves successfully, is making progress, then he would move into the co-parenting phase. And this is where we focus on co-parent communication. This is the phase where he could have sessions with his co-parent. So if a co-parent's going to participate, she has to engage really from the beginning with the clinician and have interest in participating. And she has some individual meetings with the clinician first so that the clinician can gauge whether it's safe for her, what does she want to have happen, what's really going on in the relationship, so you don't have just the father's report of how well it's going, but you actually get to hear what's actually going, which is often not the same. And so if it's safe and appropriate, then some joint co-parent focus sessions. So when I say co-parent, it's not couples therapy. It's focused on how do they communicate to benefit their children. So what are the ways they speak to each other? What are the ways they communicate? How do they listen? How do they make I statements to make requests about what they need? And how do they have positive communication to benefit their children? And then the last phase is restorative parenting. And this is where we really try to help dads think about what they've learned in the intervention about emotion regulation and how do they apply that to their parenting skills. So if they're doing better with identifying and managing their emotions, how are they teaching that to their kids? How are they co-regulating with their children? But also, how are they taking some responsibility for what their children have experienced? We have them write a letter to their children, acknowledging what their kids experienced in terms of witnessing violence, making an apology, and then talking about the things that they're learning in treatment that they want to do differently. And if it's possible, and the child is old enough, we would actually have a joint session with the father and child where the clinician would help support the father in delivering that letter to his child. And I can talk more about that in the question section if you'd like. So that's the intervention. I want to end my talk by telling you a little bit about our evidence base and sort of where we are now and where this intervention is available. So we're lucky that we have a partnership with Connecticut Department of Children and Families. They've been very invested in this intervention. They were really looking for something different to offer to fathers that come in contact with the department because of intimate partner violence. And so they started an initiative back in 2015 is when we started. So we just had our 10th anniversary. They have a program called IPV FAIR, Intimate Partner Violence Assessment and Intervention Response. So you may hear about IPV FAIR out in the community or in the courts. IPV FAIR includes Fathers for Change as one of the interventions that's part of the model. So IPV FAIR is offered in 6 regions of the state, all 6 regions of the state. So there's an agency in each region that is funded to deliver IPV FAIR. And what that means is families are referred, both fathers and mothers are referred to the IPV FAIR teams. They complete an assessment. Let me see if I have a slide about that. They complete an assessment with the clinicians, and then there's a whole safety planning section that happens. There's psychoeducation about what is domestic violence, and some case management services are available to families as part of the program. But then fathers are offered Fathers for Change, and mothers can participate as well as part of the program. So we did a statewide evaluation. We've done several statewide evaluations of this since it's been going on for 10 years now. And what we found in the initial look at the intervention is we had 519 families referred, and we ended up having 272 who completed completed Fathers for Change. So 101 families dropped out of those referred. You can see here just a little bit about the nature of, this is statewide, so it's fairly representative of the DCF population in Connecticut in terms of this, the racial and ethnic makeup of the sample. About 55% were married. And what you can see from this, we did some statistical analysis to look at change in abusive behaviors from pre to post intervention, and also children's exposure to conflict. And this is mothers' reports of fathers' abusive behaviors on the abusive behavior inventory, and mothers' reports of children's exposure to conflict for fathers who have participated in Fathers for Change as part of IPV FAIR. And we found that there was a significant reduction, in intimate partner violence over the course of the 6 months of intervention, and also children's exposure to conflict. And then when we think about that mechanism of change, right, the emotion regulation, so the difficulties in emotion regulation scale is a measure of emotion regulation. And so dads who participated in Fathers for Change saw significant improvements in their emotion regulation, which is good because that's what we were trying to target. The other thing that's important is we had high retention rates. So you heard the dads talk about that they liked the program, which is important because a lot of times fathers don't like the batterer intervention programs. There's very high dropout rates, even though they're court mandated to attend those programs. So Fathers for Change through IPV FAIR is not court mandated. Certainly DCF makes the referral and encourages families to attend. So that gives them a little push to participate, but it is a voluntary service, and we had 73% completion rates for the program. So then next we wanted to look at, well, how does that was like looking at within group, right? Those that completed treatment, how did they do? So then we wanted to compare to a sample of families that did not get Fathers for Change. So there was comparable levels of violence. They were in comparable regions of the state, comparable, background and demographic information for those families, but there's only a limited number of slots for IPV FAIR throughout. So even though there's an agency in each state, they still have limited capacity in terms of the funds. So there's many families that could be referred who don't get to receive Fathers for Change because the wait list is too long. And so then they end up getting referred to other community services for domestic violence. So we did a match control sample for that, and we paired families who had been referred to Fathers for Change and completed Fathers for Change to 297 matched. So each family was matched on a variety of different factors to try to make sure they were as similar as possible. And so we had 297 Fathers for Change families and 297 match controls. And what we found is that, so we were looking at child maltreatment reports 12 months after referral to the Fathers for Change program, so tracking families after intervention ended. And what we found is those that had Fathers for Change, 14% had a re-referral to Child Protective Services over that 12-month follow-up, compared to 27% of the control family. And so control fathers were 2.5 times more likely to have a repeat maltreatment report during the 12-month follow-up than those that had Fathers for Change. So we were pretty excited about those findings. Then we had COVID happened, right? So we were in a position, luckily, where because this was an individual therapy program and not a group, we were able to immediately transition all of the families receiving Fathers for Change through IPV FAIR to telehealth. So they were able to continue to receive services during the pandemic. We were able to continue to do new intakes and see families during the pandemic. And so we collected data on those families as well. And so we compared the COVID recruitment families that received Fathers for Change through telehealth to our in-person families that had received Fathers for Change in person pre-COVID. And certainly there were different things happening in the world during COVID versus pre-COVID. But what we found is we were actually worried that the telehealth delivery would have poorer outcomes, that it wouldn't be as good, that people wouldn't benefit as much. And actually, that was not true. The outcomes were pretty consistent in terms of what families got from the intervention. And actually, dads were more likely to attend during the pandemic over telehealth than they were pre-pandemic. Now, could that be because dads maybe weren't working as much or they had more time on their hands? Certainly, yes, but they were much more they attended more sessions and were more likely to complete treatment via telehealth than they were in person. I see there's a question in the chat. I'm going to save it to the end because I'm almost finished, and then we'll go to questions. So basically we found, so this paper has been published as well. Everything I've talked about so far has been published, that we have initial evidence for telehealth delivery of Fathers for Change, that the outcomes were consistent, and that remote sessions might increase engagement for dads in particular, because they could squeeze in appointments on their lunch break. They can join from different times, and that could be a successful option. The last evidence I'm going to tell you about is a randomized controlled trial that I finished that was just published in 2025. This is a small trial where we compared Fathers for Change to that standard Duluth model batter intervention program. One delivered an individual format. So Fathers for Change is an individual therapy, which is really different from a group psychoeducational intervention. So we made an individually delivered Duluth model. So still focusing on that power and control wheel, the feminist views about IPV, and delivering that more individually to tailor it to the individual dad. And he had a one-on-one meeting with a therapist. And then we also had a group that received it in its standard form, in group format, delivered by two facilitators, a male and a female facilitator. And so we looked at pre-post, how did dads do in terms of reductions in IPV? And so what we found, so this is just to show you our three groups. So this was a small sample of dads, I think 90 something dads total. And the interventions were delivered over 18 weeks, and we collected, so we had pre-post abusive behavior inventory reports, and then we also had weekly reports of their interactions with their co-parents during treatment. So we could look at both physical and psychological IPV over the 18 weeks of treatment to see how that looked and if it changed. So here we have the pre-post abusive behavior inventory. So we have both the Fathers for Change group and the individually delivered Duluth model batter intervention programs had significant improvements. Fathers for, and pretty good effect sizes in terms of that change in violence. The group intervention did not see significant changes in IPV over the course of treatment. And then the Fathers for Change group also saw significant improvements in the dad's emotion regulation, which again is what we were focusing on. So if you're trying to improve emotion regulation, you want to make sure you're actually doing that, which Fathers for Change did, but neither the other two groups did not improve emotion regulation, as expected, because they aren't focused on that. So the other key thing here is so this is the raw counts for intimate partner violence episodes, either verbal or physical, during those 18 weeks of treatment. So you sort of expect people while they're in treatment to be on their best behavior, actually. That people tend to do better while they're in treatment because they're getting the support. So you can see here the mean number for Fathers for Change for the participants was about 1 episode per over the 18 weeks would happen. For the individually delivered Duluth model, it was a little, between 3 and 4 incidents over the course of treatment. And for the group treatment, it was 12 episodes over the course of the 18 weeks. So this is just a picture view of what that looks like over the course of the treatment. So the Fathers for Change, is the blue here, and you can see that they had a few blips at the beginning, and then really they level off and are not reporting incidents over the course of treatment. This is the individual here in the green, the individual Duluth model. So you can see that there's some improvement, and then there's some, it's a little up and down here toward the end. And this is the group intervention where you see that they're really having some substantial numbers, over the course of the treatment throughout. So what do we take from this? There's this idea in the field that individual treatment is not appropriate for intimate partner violence treatment, that it has to be delivered in group, that's the only way that they should receive treatment. These results suggest that may not be true, that individual treatment may actually reduce violence more than a group intervention. And we need to dig in a little more in terms of whether Fathers for Change had the best outcomes of the 3 groups, but the individual intervention also had good outcomes. So we're currently running a large trial to look at the differences between Fathers for Change and the individual Duluth model approach. So we have 2 current trials, one that I just mentioned, and then we also have a second trial, which I didn't get into today, talking about my studies with substance use populations, but we've also seen significant improvements of Fathers for Change for men who have problems with substance use, with better outcomes related to relapse than other substance use treatments. So we're right now comparing Fathers for Change to individual drug counseling in a large trial. So this is the number to the Yale Child Study Center's outpatient clinic, where we do have our, the original, the mothership of the Fathers for Change program or the fathership, as it were, is located at the Child Study Center. And so referrals come in and they can be screened to see if they want to participate in our research trials or if they don't want to participate in research. The benefit of participating in research is they get paid for some research assessments, and they get free treatment without need for insurance. But they also can receive Fathers for Change within the Child Study Center outpatient clinic, with insurance or on a sliding scale. So there's multiple ways to access it. And then if people are in other regions of the state, like I said, DCF has funded these 6 agencies, so 1 in each region. So wherever you live, there should be an agency that offers it. Those programs, they're called, like I said, called IPV Fair, requires a referral from DCF. So they do have to have an open DCF case to get Fathers for Change through those agencies. So last thing, this is the book that was referenced in my introduction. This is the manual, the published manual for Fathers for Change. So if you have interest in reading more about it, this is the book. It's published by Guilford Press, available on their website. And the last thing I'll say, what I really believe in is I really believe that people can recover and change, and that we can help families have reductions in violence. Whoops, I lost my slide. Oops. And so, I really think we need to think about how we're offering people a space to change and to reflect honestly. And when we approach people who use violence only as perpetrators and offenders, and that's all we see, then I think we're missing an opportunity to have them be more able to have a space to grow and change. So as you think about your cases and the families you work with, I think sometimes we often, and I've fallen into this too, we sort of demonize one parent over the other, and we're advocating for just the one person that we work with, and that it's more complicated than that. And there often can be ways that we might be able to make change that would benefit everybody.